Hi, my name is Julian Reyes. I am a student nurse. Today I will be showing you how to prepare a powdered drug through Reconstitution, and I will be administering it through IV mini bag. So first of all, I'm going to do my hand hygiene. And before anything else, I've already compared my drug medication, my MAR, against my physician's order. And I've already pulled my Azithromycin from the Pyxis. So I have this medication already, and I'm also checking for the integrity of the medication, if it's expired, and if there's any discoloration, and there's none, so it's good to go. And I'm going to be checking the medication against the MAR for my first check. So today we have Watson William, a 34-year-old male who is admitted in the emergency room with pneumonia, and his allergies is shellfish. And I have here Zithromax, which is supplied in a 500 milligram vial, and I have 400 milligrams in my MAR to be administered through IV, and this is an IV medication, and this is administered once in a day, and the time is now, which is 0900 hours. And I've also looked at the parenteral drug monograph. It can be administered by a nurse or a student nurse. Its usual dose is 500 milligrams IV daily, and the prescribed is 400 milligrams, so we're good. And it is also reconstituted with sterile water, so I've grabbed my sterile water. So I also have my 5 ml syringe and my blood fill, and I'm going to clean the tops of the vial for 30 seconds each and letting it dry for 15. So I'm just gonna put this aside. So for a 500 milligrams of Zithromax, I need to reconstitute it with 4.8 mils of sterile water. So I'm going to draw back 4.8 mils of air, and we'll attach my blood fill and my syringe by being careful not to touch the tips to maintain sterility. So I'm going to draw back 4.8 mils. Okay, so that's 4.8, and I'm just gonna carefully get rid of the air and the bubbles. And I have 4.8, and now I'm going to instill that in my drug vial. And I will let the air pressure automatically fill my syringe to make sure that I put in the correct dose. Okay. And using the scoop method, so we won't get any needle stick injuries. And I'm just gonna mix that by rolling it into my palms. So that's good. And there's no sediments, and it's well mixed. And I've done my calculation ahead of time. So the MAR says 400 milligrams of Zithromax, and the concentration of the vial is 100 milligrams per mils. So my calculated mils is 4 mils. So again, I'm going to draw 4 mils of air. And I will instill that air into my drug vial.
finishing my first check here. I'm just going to look at my photomonograph to see how this medication can be administered. Also, my patient's
Make sure that when you draw your medication that your bevel is in the liquid. Okay, and we have 4 mils. Okay, so I'm administering this by IV mini bag, and the PDM says to dilute it in 250 to 500 mils of normal saline or D5W. So I've chosen 250 mils of normal saline. I've compared that ahead of time with the solution that's infusing in the primary line, and it's normal saline, so it's compatible. Also, normal saline is compatible with the drug that we have, which is azithromycin. So I'm going to do my second check before I instill the medication in my mini bag. And I've also prepared my label ahead of time. So I have William Watson, Azithromycin or Zithromax, and I have it in 400 milligrams at 4 mils. And the time is now 0900 hours, and the date is 14/02/19, and it is to be administered by me. So now I'm going to swab the port of my mini bag. For 30 and let it dry for 15. And I'm going to be careful as I insert the needle as to not perforate the mini bag. Okay. And this is good. I don't need this, so I'm going to discard that in the sharps container. And I'm going to give this a good shake. So that's good. And I'm also going to put my label onto the mixed mini bag with the medication. All right, so now we all have our medication, and we can now give this to the patient. So, and I'm going to give this with a secondary medication set, the tubing. I will also bring the MAR to my patient's room. And also I prepared a label for the tubing. So yeah. Hi, William, how are you doing? And as I enter the room, I make sure that I'm doing a safety check, that there's nothing posing any hazard, and that the patient is not in any visible distress. And I'm also going to do my hand hygiene as I enter the room, and also I'm going to be checking the primary line if it's infusing at an appropriate rate. Also, I'm going to compare the patient's identity band with the MAR. Can you please just state your name for me? Okay, and your date of birth and your allergies. And also, while I'm here, I'm also going to be checking for the IV site for any signs of infection, redness, swelling, infiltration, and the patient is good. And I'm going to check the tubing, and it's good. So I'm going to be doing my third check. William Watson, azithromycin, allergies, shellfish, 400 milligrams at 4 mils of azithromycin in my mini bag to be administered via IV daily, once in a day, and to be administered now at 0900 hours. So first of all, I'm going to open my secondary tubing. It comes with a hook, and this is to be used with the primary line. I'm going to hook that. And I'm going to be choosing, so there's 3 ports in the primary line. I'm going to be choosing the port that's above the pump. Also, I would just like to note that I've chosen normal saline because the patient is not in need for any additional nutrition or electrolytes, and it is the one that's compatible with the primary line solution. So just gonna set this up. Okay. And I'm going to swab. I'm going to swab the port for 30 seconds and let it dry for 15 as well. And make sure that the tubing is clamped so I don't lose any medication. So that's clamped. And I'm going to spike my mini bag. Okay. So I'm gonna carefully unclamp and lower it to back prime it. And the chamber is filled 1/3 to half. So I'm going to hang that up. And before I give the medication, before I infuse that, I'm going to do my patient education. Have you taken this drug before, the Azithromycin? So this is an antibiotic. It's to treat your respiratory tract infection, which is your pneumonia. So you are going to feel nausea, vomiting, or diarrhea with this. And if you feel any of those side effects, please just let me know and I will check in on you, okay? All right, and the patient did not refuse. So I'm going to check the tubing. It's good. And there's 3 drops. 1, 2, 3. And I'm going to set that up. Secondary line. And our final volume, which I did the calculation for, is 254 mils per hour because our total volume is 254 mils. And the drug monograph says that it's to be infused in 1 hour. So 254 mils per hour, 254, and that's good. And confirm secondary, and I will start. So yeah. All right. So before I leave the room, I would just like to check for another safety check. Make sure that the patient is not in distress and also that the bed rails are up. Currently it's not. And I will also be checking if there's any tubings that's on the floor. And also I will check if, I will also be checking in on you after when the medication is done. Okay?